Poverty and health are inextricably linked. If you've got a lower income, you will not be able to eat healthily, you'll not be able to heat your house, you'll not be able to travel. It has a massive impact on your physical and emotional and mental health and well-being.
I think in health, in medicine, we are now increasingly aware of the fact that health is socially determined. The evidence base for that is overwhelming, and so that is increasingly becoming part of our role as GPs, particularly in poorer areas, is to ask about people's money issues.
So the Welfare Rights Service deals with a high proportion of clients who claim sickness or disability benefits. At one point, when we looked at the number of clients or the proportion of clients, it was 74% of those accessing our service. So we felt that there was a need for potential service redesign and looking to see whether there was a better way of actually reaching those clients rather than just the traditional ways where clients came to our service looking for help with their benefits.
We knew there were a number of issues being raised within general practice which general practitioners couldn't deal with directly. We were getting a lot of referrals to advice agencies from these practices, so it seemed sensible to locate the services together, and that's when welfare rights advisors started to be co-located or embedded within general practices.
Well, we're now very fortunate in that we have a welfare advisor as part of our healthcare team, and so we now, whenever we identify a welfare problem, we will speak with a welfare advisor and often just book the patient directly in with the expert.
So the advisors offer a full casework service, but that can include any sort of benefit that they might be entitled to. It can include disability benefits as well as means-tested benefits such as income support or tax credits or universal credit.
Based within the GP practices, we're able to build up good relationships with the medical staff. We have a good working relationship in our GP practice with them. We're able to access medical records with client authorisation, and that enables us, when we're assisting clients and advising them on any benefits they may be entitled to, that we're coming at it from our experience and our perspective and not relying on medical staff trying to interpret what is required to meet the benefit criteria.
So one further advantage of having a welfare advisor as part of the healthcare team is the educational benefit that we get. Not that we become experts in welfare rights, but it does mean that we have someone who can educate us, and this is an ever-changing field, so we can then actually give some information to patients.
The difference between outreach and an embedded model is that the advisor, in this case, becomes part of the practice team. So they're fully integrated within the practice. They're able to attend practice meetings. They have, a ongoing dialogue with the practice staff. They can talk about individual patients, and with the patient's consent, they can access the medical records of the patient, which in turn then cuts down time for the advisor, the GP, and from the patient's perspective, it seems that they're getting an integrated and seamless service.
For us as a practice, we've noticed a real reduction in our workload as GPs, because I no longer have to write appeals letters, I no longer have to actually supply supporting evidence for people's appeals and claims and things like that, because all of that is dealt with by our in-house welfare advisor.
Patients, what we know is that they find it a lot better than having to, say, access a traditional advice service, where you're walking through the door of a building where people only go if they've got problems. So what a lot of people say is they find that stigmatising. Whereas if they access advice within their doctor's practice, then the report is that there is no stigmatisation whatsoever, because you may be going in to the doctor's practice for a variety of reasons.
Well, I think the benefits we found to the patients, one is the direct benefit in terms of enabling them to access an income, and often to help with their accommodation. But also it then means that that patient is often empowered and can then start to look after themselves more and start to look at other issues in their lives, which when they feel so defeated by a welfare system that is so difficult, that is impossible.